Hello, this is Δημήτρης Διονυσίου, and we are doing the D2D Lymphedema podcast. It's my honor to present everybody Victoria, who is, I'm going to call her Vita, a very good friend of mine from Stanford University. She's a registered nurse in California, US, and her story is that she was born in Ukraine and immigrated in 2000 exactly in UK, in US. And then she was a registered nurse and always was dealing with oncology patients and take care of patients with cancer. I met Vita about 5-6 years ago in California, and made me fantastic impression because she's dedicated to lymphedema patients and always take care of a beautiful lymphedema clinic in Stanford and look after the patients of Dr. Nguyen, and especially in lymphedema. So welcome, Vita.
Thank you, Dimitris. It's a privilege and honor to be here.
It's an honor to have you in our podcast series. And let me speak about a little bit for lymphedema. I mean, this is a series of lymphedema. The majority of patients of the people who listen to the podcast, they know about lymphedema. But we need a little bit to discuss what is the role of a registered nurse. What is a registered nurse dealing or looking after the patients for lymphedema?
My role in the clinic as a registered nurse is to be patient's resource. And it starts with education, demonstration, always being there available for them with any questions, but mainly education. I feel like this area of medicine is untapped, especially in the US, and there is a lot of information that you can find on the web or on the support groups for breast cancer or lung cancer, prostate cancer, but there is not much about lymphedema. So we feel like we are at the forefront to educate the community.
I completely agree, and this is not only in US like a problem, or like we don't have a lot of people that they can look after the patients, but it's everywhere. It's not like US, Europe is the same. I presume that Asia, they have the same thing. Can you tell me a little bit about how you became, how you became with interest in lymphedema? I mean, you will always be kind of looking after patients in oncology, dealing with breast cancer patients, but how come you see lymphedema like a challenge? Or tell me your story.
It's an interesting story, and it's a little bit of a spiritual story to me. I became a nurse 12 years ago, and I remember it has always, just like you mentioned before, it has always been oncology. There was nothing but oncology, and I would never change it for anything but oncology. This is where the passion is, because it's a science mixed with relationship. You always treat not only the patient but the entire family. So I really enjoyed that part of medicine. 12 years ago, when I became a nurse and I was working on the acute oncology unit, I met a stunningly beautiful. And unfortunately, at the age of 26, she was diagnosed with vulvar cancer, went over treatment, very radical hysterectomy, pelvic extension, and all of that, which left her with lymphedema of the leg. At that time, I did not know what it was, but I just saw her being in the hospital for treatment of her cancer, and then putting the stocking on and the stocking off and stocking on and stocking off, and telling me how her leg has swollen and has been swollen for 26 years, but she's doing a good maintenance, and she's doing the garment and the wrapping and pumping, and she's also going all the way to Europe, from California to Europe to Wittlinger Clinic in Austria every summer for 3 weeks. So she was telling me all of this, and at that point of time, it did not even resonate with me. I just thought, okay, that's a challenge. This is what she's going through. But we focused on her cancer disease.
Okay.
fast forward 10 years, I end up in Stanford with Dr. Nguyen, who is a fantastic surgeon, and she asked me, I was supporting her in her breast reconstruction clinic, and then she said, I'm going to start doing surgeries for lymphedema. Are you in? Are you interested?
So
like, okay, yeah, I've heard this word before. Let me educate myself. So I learned a lot from Dr. Nguyen herself. I learned a lot from web education, from all the classes that I could possibly take, and went on the conferences, met people in Taiwan who invented the surgery, met you, Dimitris, to learn about what you do in your clinic. So all of that started coming back to me 10 years later from what that patient was doing. Oh, she was putting on compression garment. Oh, this what lymphedema was. So this patient unfortunately passed away from her disease, but I feel spiritually like she used me as a vessel for other patients with lymphedema to provide service. And this is why this topic is so near and dear to my heart. I do it in her honor. And every time when I can help at least one patient, I feel like my day is complete and the mission is there to help. But that's the story behind the lymphedema and interest in it.
Very emotional. I mean, and this is true. I mean, I think the passionate people who like something, who are involved with something, they have kind of story behind, and it's always like that. Okay, so
always a story, yes.
Yeah, I mean, when we talk about lymphedema, we have a kind of we have to know what is lymphedema, what is the physiology, and then we have to speak about the pathophysiology, which is the pathology behind the disease. And we all know that we are full of lymphatic vessel. Lymph is a kind of liquid that it's a protection of the organism with a lymph node, so it's a big connection. And thus we know that the whole organism collects lymph from the hands, from the feet, up to the neck, and here's a kind of circulation between the lymphatic and the circular, the blood system. So a little bit of the physiology. And then we have to speak about the prevention of the lymphedema, how we can prevent lymphedema, how we can treat lymphedema. That is going to be the content of the discussion. So would you like to tell us a little bit about the physiology and how you educate the patients about the pathology they have?
Yes, of course. This is the integral part of lymphedema treatment. I feel like knowledge is power. Once you empower your patient with the knowledge, they understand how it should be in the normal setting. What can go wrong, which is pathophysiology, what can be done about it, when to panic, when not to panic, when to address right away, when can it wait for a few days. So all of this is very important. And I always start by telling them that lymphatic fluid is sometimes even more important than our overall circulatory system, because it's a filter. It's the fluid that delivers nutrients to absolutely every organ and system in our body and removes waste. When this balance is disrupted, that's where the problem starts. So prevention comes as at a first place, where you need to keep your lymphatic fluid, or as it is called in the literature, the secret river of health. You need to keep it liquid, you need to keep it fluid, you need to keep it clean. And all of this is possible with proper hydration, with proper movement, with proper even supplements if you want to take them, or certain foods that promote the health of lymphatics. All of that people want to have this information about, to be in control of their lymphatic system. Also, in our case, we see patients who have disease like lymphatic disease as a result of oncologic treatment. So I always explain to them that we as a whole organism, if there is an impairment somewhere, the whole system will get impaired. So by improving and boosting the whole system may help promote the health in the diseased extremity or in diseased part of the organism. I always teach them to start their morning with 10 deep diaphragmatic breaths. It takes 5 minutes of your time. It costs absolutely nothing in terms of money. So why not doing it? So people love doing that. They want the demonstration. They want to show me how they know how to do it. So they really enjoy doing that. We also teach them about infections. Infections come with lymphatics, right? With lymphatics impairment. And I always teach them that, let's say, an arm after breast cancer, if you have a mosquito bite in a normal arm, nothing bad will happen. You just scratch it out and you forget about it. A mosquito bite in the diseased arm can take person's life, unfortunately, if it's not treated on time. So I always teach them not to scare them, not to have an impact on their quality of life, but more to empower them with the knowledge to recognize the problem and how to deal with it. I always teach them, if they go somewhere on vacation, you always have a bottle of antibiotics with you, just in case. Just in case there is some redness, there is some swelling, you start preemptive antibiotics right away until you get help, especially if you're in a foreign country where you don't have access to your doctor, where you don't have access to your pharmacy, things like that.
Okay, yeah.
We always teach them about where things are located in our body. We always teach them that lymphatic system is the biggest organ of immunity, and immunology of itself is a very, very complicated topic for even people in the medical school, let alone lay population where you don't have medical background. So I always teach them, think about lymphatic system as your biggest organ of immunity. Every single lymph node, and we have 600 to 700 of those in our body, each and every lymph node is an organ of immunity. I also teach them that not every lymph node is a draining lymph node. So they need to distinguish where we have the draining lymph node and not to damage them inadvertently. Like some people would go for a massage, and the massage therapist, if they're not experienced or if some of them don't know what they're doing, they would press too hard on the lymph nodes in the groin or behind the knee or in the axilla, and they can damage. I'm speaking from experience in our clinic. They can damage the lymphatics just by doing incorrect massage. So people should be educated to know where are the clusters of lymph nodes in our body, right? They want to understand why, if we have flu or cold, why do we have our cervical lymph nodes swell up? So they enjoy understanding that the nodes swell up in response to this infection or bacteria. So this type of education, people really enjoy. I also teach them to understand about the diagnosis of lymphedema. It is never enough to just show up and say, hey, listen, my arm is swollen or my leg is swollen, I have lymphedema. No, we don't know. You need to have diagnostic tests, because the swelling can come from a different source. It can be cardiac in nature, it can be kidney in nature, liver can cause swelling. Right? It can be vascular in nature. So we also educate them to make an educated decision and listen to the provider and do a proper diagnostic and then treatment. Mm-hmm. So this type of education people appreciate.
Yeah, Vita, a lot of time we have questions from the patients about the condition. But before that, I would like to just stay a little bit of the prevention, little bit connecting with the lifestyle of every patient, because sometimes we have to learn about the patient, what is the daily activities, what they do, how's the lifestyle, what they like to get dressed, what they like to get, well, to what are the activities if they do some sports. How important do you think that this is, to know exactly the habits of every patient, or everybody who is like a kind of possible to become patient if they had any lymph node dissection or radiotherapy?
Patients at risk, we always educate them at the time of axillary dissection or groin dissection if it's lower extremities. We always educate them to protect themselves from inadvertent harm. So do not harm is the basic principle of any healthcare provider, but we also try to educate our patients, even who don't have lymphedema, but they are at risk. We teach them, do not allow anyone to harm you inadvertently. For example, if it's an upper extremity at risk, right? After axillary dissection, always remind whoever needs to, let's say, do a blood test for you or take your blood pressure. We always remind them, do not allow them to do it on the arm that had axillary dissection. Do it on the contralateral arm, unless it's a life-saving measure. Then nobody cares, right? They need to save your life. They will start IV wherever they can find the vein. But if it's a normal setting in a daily routine appointment, remind them, I had axillary dissection. Please do not inject this arm. Please do not put blood pressure cuff on this arm. Use the other arm. We always remind them, people like to travel. This is fantastic. We want them to travel. We want them to enjoy their life. But if it's a long flight, have the garment with you. Put the garment on your arm. Put the garment on your leg. This is a great practice for anyone. I would recommend it to anyone, lymphedema or not lymphedema, but especially for our patients who are at risk. Have the garment, have a habit of putting the garment on. If you go to the gym and you know you will be lifting weights, put the garment on. Help your lymphatic system to cope with the existing impairment. I always teach them about two lymphatic systems that we have, deep and superficial, and how they're picking up from each other, right? If there is an impairment on the deep level and patient does not have lymphedema or any signs of lymphedema, it means their superficial lymphatic system is kicking in and working for two. Right. So we want to protect that delicate lymphatic system that is now working overtime from any harm. So garment for high elevation, if they go to the mountains or if they take an airplane ride, garment on. If they're doing strenuous activity, garment should be on. So prevention is the key, always keeping them well hydrated. If people are at risk, I've heard this in multiple podcasts, and I've heard it from the Whitlinger Clinic, they do not recommend any heat procedures like sauna, jacuzzi. All of that need to be taken into consideration not to trigger the onset of lymphedema.
Yes, correct. Now let's discuss a little bit about treatment. So let's say these are a little bit of prevention measurements, what we have said so far. So let's move to the second part, the treatment part of the lymphedema podcast. So we have to deal with patients that they already had like a secondary lymphedema or primary lymphedema sometimes, and they may be a little bit advanced, like stage 2, stage 3 lymphedema. All patients ask me when they come to a surgeon if they can be treated, if they can be cured, and because they little bit get rid of they are tired about wearing pressure garments or having all these bandages for many years. But I think it's very important to describe them. How important is the role of physiotherapy before we do the surgery for them? Can you comment on that?
Absolutely. We always emphasize that unfortunately, at this point in time, there is no cure for lymphedema. There is no cure, but there is a remission. There is maintenance to the point where people may forget they have lymphedema, and we have to remind them, hey, you need to remember, you need to prevent, right? So we always differentiate between conservative treatment and surgical treatment. And those two go hand in hand because we, even in our surgical lymphedema clinic, we heavily rely on conservative treatment before and after surgery. And I don't know if you touched that on your previous podcast, but you as a surgeon, I'm sure you want extremity to be optimized before you operate on the arm or leg with lymphedema, right? You want that extremity optimization. You want them to go to physical therapy. You want them to be compliant with compression garment. You want them to use compression pump to make sure the arm and leg looks the best it can possibly look for surgery, because that helps with the best possible outcome. Mm-hmm. After surgery, people have to understand, and we always explain it to them, if it's a lymph node transplant or if it's a lymphatic-venous bypass, the body does not drain right away. That lymph node is an immature baby lymph node that needs time to cope with the volume of lymphatic fluid. So physical therapy is of utmost importance to help mobilizing that fluid. So we always tell our patients from day one, when we see them in the clinic, they need to have a certified, reliable, knowledgeable physical therapy within their arm reach. And if they don't have one, we always offer this resource. We have a list that we compiled over the last 10 years of the best physical therapists, MLD therapists in our area, as well as garment fitters. I want to touch base on the garment as well. We always try to tell people that ill-fitting garment, poorly fitting garment can do more harm than good. So the garment needs to be ordered from a certified fitter. They need to be measured. They need to be ordered to fit properly, because if it doesn't, it can damage, as you know, it can create tourniquet effect or be too loose. So we always emphasize on the importance of this relationship with lymphedema therapists before and after surgery. Yes, eventually after surgery, as people get better and better, they can spread out their sessions with lymphatic therapists. They can see them instead of twice a week, they can see them maybe once a month or maybe a couple of times a year just for little maintenance. But initially, before surgery and after surgery, it's very important. And this step cannot be skipped.
Yes, I mean, I agree with you, especially on the beginning when you said that there is no cure of lymphedema. I mean, we have seen patients that after surgery, some of them, they have completely cured. Some of the patients, we have seen that they've done so well that they don't have the need to wear garments anymore. But I don't know any surgeon to promise cure to these patients. And definitely there are so many stages, so many different categories of the patients. Each individual patient is different from any other patient. Sometimes it's different in primary lymphedema between the two arms, between the two legs. So there is a variety of the treatment and the diagnosis. So as you said, it's a kind of individual training and the education you give to each patient based on the lifestyle, based on the problem they have. And for how long do you keep on going and see patients after the surgery or after the treatment is started?
So of course, I also want to go back to what you said. Every patient is individual and their compliance and learning mode and learning styles are different. But I noticed since I started in this clinic, once you explain to patient and they understand the main question, why things happen the way they happen, it's not just, oh, you need to wear the garment because I said so. No, they need to understand why, why things happen the way they happen. Once they understand, the compliance goes through the roof. They really want to be in control of their disease or their remission. Yeah. It's fantastic to be in remission, right? Yeah. But to answer your question is, how long do I see them? I have patients that I have been seeing for 10 years, and they like to keep in touch. I think this relationship of patient to nurse, this part that what keeps me in oncology, because people feel they have this resource for life. And to me, it's an honor and privilege to be that resource. Mm-hmm. People can reach out to me at any time. They have my email, they have my cell number. whatever they need. And sometimes they even call and they say, oh, I'm fine, everything is okay, but my sister has this problem. Can I connect you to? So people build this relationship, and I'm happy. Like I said, I'm privileged to be this resource. But usually we see them up to a year on a frequent basis, and that's when we start weaning them off the garment. And once they're off the garment, if they are keeping their lymphatics in health, in good health, and they're compliant with seeing the physical therapy, they don't need to see us. But again, if they choose to, or if, let's say, they have a recurrence of the disease, or something goes on, like structurally in the extremity that impairs lymphatics, they always reach out, always.
Yeah, I think this is very important. I mean, the patients also feel a little bit secure, knowing that
It's true.
you are there. So if they need us, they know where they could find us. So
absolutely.
Okay, I think we covered a lot of this subject, and we are still in the beginning. So unfortunately, we have to close this podcast for today. It was very nice. It was beautiful that having you in the podcast. You gave a lot of insights to the patients, to the medical health providers. Thank you from the deep of my heart being here with us.
Thank you for the privilege, Dimitris. Thank you.
Bye-bye. Thanks a lot.
Okay, bye-bye.